Aphorism number 39, explanation. In this aphorism, Dr. Hahnemann has given idea about chronic diseases does not cured by allopathy. Physician who stick practice for long time to the ordinary school of medicines allopathy saw all these about dissimilar disease and its effects what we studied in previous aphorism. For so many centuries, they saw that even nature herself cannot cure the disease by adding the another disease, even though it will be strong and dissimilar to the original disease present in the body. What shall we think of them? In spite of all these, they went on treating chronic diseases with allopathic medicines and prescriptions which are capable of producing God knows what morbid state, invariable, mostly dissimilar to the original disease to be cured. Even though, in spite of all these physicians till now did not observe the nature carefully, at least the miserable result of their treatment should have taught them that they are pursuing or following an inappropriate false path. Did they not pursue, realize when they employed an aggressive allopathic treatment in a chronic disease? Thereby, they only created an artificial disease which is dissimilar to the original disease, which is kept up as long as possible, which suppress or suspends the original. But latter, however, it always return as soon as patient with diminished strength did not continue the allopathic attacks on his life. For example, each exanthema eruptive disease with the fever as smallpox or measles disappears very soon from the skin under the employment of violent purgatives which is repeated frequently. But when patient cannot bear the action of purgatives, that is dissimilar disease of bowels, and cannot take purgatives, then either cutaneous eruption breaks out as before or internal sora may express through some other bad symptom which is added to the suffering of the patient with undiminished original disease, and he has to bear in addition painful ruined digestion and impaired strength to boot. So also when the ordinary physicians keep it in center artificial ulceration or any local maladies which is expressed on exterior of the body with the view of these local maladies, if they try to eradicate chronic disease, they can never cure by that means, because such artificial cutaneous ulcers are quite alien and allopathic to the internal affection. It means such artificial local affections are quite different or dissimilar to the internal affections, in as much as the irritation produced by several tissue is at least sometimes a stronger dissimilar disease than the internal indwelling malady. Therefore, latter internal malady becomes silent and suspended for a week or two, but it is suspended for a very short time when patient power are gradually worn out. Epilepsy, suppressed for many years by means of any issues, they recurred in more aggravated form when they are allowed to heal up. But purgatives for each and issues for epilepsy cannot be more heterogeneous and more dissimilar deranging agents, and they cannot be more allopathic and more exhausting modes of treatment than are the customary prescriptions, which are composed of unknown ingredients used in practice for the other harmless, nameless, innumerable forms of the disease. These same way do not do nothing but debilitate and only suppress or suspend the malady for the short time without curing it. When it is used for longer periods, there is development of new morbid state to the old disease.